So this is uterine cancer. Really, uterine cancer is any cancer found within the uterus. Most of them are endometrial cancers, and some of them are actually in the walls of the uterus itself, either in the connective tissue or in the muscle tissue of the walls of the uterus, and those would be called a sarcoma. Sarcoma is non-epithelial uh, malignant tumors. So technically, it's any cancer in the uterus. Um, it accounts for quite a few diagnoses in a year, but the mortality rate is very low, 7,300, 7,400. This is found on page E10, 8, chapter E10, 8, 9, or I'm sorry, 7 and 8. Um, in the online stuff. Uh, they say 7,400. This book says 7,300. Who's to quibble? Lots of people survive it. It's usually diagnosed kind of perimenopause or after, so the average age is 60 years. It happens mostly in white, affluent, heavy set women that haven't had many kids, mostly in postmenopausal. Uh, it's uh, they don't understand really kind of what all the factors are, but that's who gets it. So um, we'll see in a minute that obesity tends to uh, add to it. So somehow the DNA of the affected cells gets changed. It's in the, like I say, in the endometrium, the connective tissue, and muscle cells. Estrogen exposure seems to be the big deal. It seems to be the thing. So a certain amount of race, age, uh, health seems to add to it, but estrogen is the big trigger. There's two types. Uh, so one is endometrial, and the other one's uterine sarcoma. So 95% are the endometrial cancers. So by and large, that's the one that we're looking for. Um, it has identifiable symptoms, which it's really bleeding. Um, it's sometimes called adenocarcinoma because the endometrial lining is secretory. So adeno means secretions. Uterine, much less common, only 5% of the diagnoses, and it happens in the stroma, which is the connective tissue, or in the muscle cells. And so these are called leiomyosarcomas, not to be confused with leiomyomas, which are benign, which are called the fibroid tumors. Some of them are mixed tumors. Um, the growth in the endometrial lining is really fragile. So bleeding is usually the big deal. Now, these are not really aggressive tumors. Uh, they they can spread. They can metastasize. Usually lymphatics. Um, and when they go to the lymph nodes or through lymphatics, they can cause lower extremity swelling, like lymphedema, really, in the lower extremities. Um, they can spread through the peritoneal fluid, especially if they rupture into that peritoneum, and to go to other places. They can spread through direct contact, and less so through circulatory system. It seems to go to lung and lymph node is the place my understanding is that they go to. So estrogen exposure, long-term estrogen exposure, seems to be the big deal. Um, so uh, there was a time when I thought that that having normal estrogen every 28 days and ovulating a lot uh, seems to uh, have been a um, a normal thing. And then, like I was pretty adamant. I used to lecture that's the way physiology is meant to be, and anything that screws around with that is probably not healthy or not right. I've now changed my mind through various readings and an epiphany that came to me. Up until a few years ago, basically the 1960s, uh, women had a lot of babies, uh, and basically didn't have as much estrogen throughout their life. My my great grandmother, my grandfather's mother, had 18 kids that lived. Who knows how many pregnancies she had that didn't go full term. And uh, she had Uncle Spencer when she was like 14 or 15, and she had my grandfather when she was, I think, 47. Um, and when you think about it, that woman would have been pregnant or breastfeeding the vast majority of her entire adult life. In which case, she would have been very progesterone dominant and had very little estrogen, in fact. She would have, I mean, she wouldn't have ovulated very often. She wouldn't have gone through that menstrual cycle all that often. Um, like I say, I thought that at one point having the endometrial lining stick around too long was maybe a cause of it. But now I'm thinking, no, it's the sloughing off and replacing that it matters more. So so uh, people that have never had children have had many ovulations and many cycles and probably a lot of estrogen, presumably. Um, Early menarche and late menopause is more time in that fertile period, and it's more estrogen. A lot of perimenopausal women take estrogen to help with the symptoms of perimenopause, and that may actually lead to this. I It talks about obesity here, that fat cells produce estrogen, and they do produce estrogen. Uh, and they store estrogen. It's one of the reasons why athletes with not enough fat stop having their periods. Um, there has to be a certain amount of fat because that estrogen is important. Uh, so obesity produces estrogen, and estrogen, long-term estrogen exposure, is a risk factor for uterine cancer. So, take it all with in high-fat diets, obviously for the same reason. I would probably even add high soybean because there are estrogens in soybean. Uh, Tamoxifen is a drug that a lot of people take to try and fight potential breast cancer. They take it as preventative maintenance from a breast cancer point of view, and that actually may increase the risk of um, uterine cancer. So, what are the signs and symptoms of this? Basically, it's bleeding. Uh, bleeding post-menopause, vaginal spotting between periods. Um, it's harder to identify if a woman is having regular periods or actually perimenopausal when the periods become irregular? How do you tell whether the spotting is due to the perimenopause or to this? Um, the other signs and symptoms are rather vague. They don't tend to, you know, how can you tell the difference between that and perimenopausal or uh, just life? You know, uh, unintended weight loss is a big thing. Most cancers will do that. Change in bowel and bladder habits. Again, aging does that. Pelvic pain, low back pain. Uh, yeah. So really, they make the diagnosis by doing biopsies. I mean, uh, really, if they should be doing screening tests, any with anybody who's got is in the high risk category and has vaginal discharge or bleeding. They got to look for metastasis, and like I say, often lungs is the big thing. Lymph nodes, liver, but it doesn't necessarily go to bone in places like that. So, what do they do with these people? Usually, it's they just take the whole uterus, the hysterectomy, and they also take the ovaries when they do it, mostly to deal with estrogen. Um, they can do radiation therapy. They can do some hormone therapy with progesterone or artificial progesterone. Uh, it's interesting because one of the hormone therapies they can do is tamoxifen, which is rather strange that it's on the risk side as well as on the treatment side. Um, really, it's is it contraindicated? It's probably relatively contraindicated to have massage. It's the same risk factors as any other um, cancers. You probably don't want to spread things through the lymph by doing lymph drainage massage, that kind of thing.